Fillers are a medical grade product that we use to treat volume collapse. So the volume collapse happens as we age. The tissues in our face will shrink and get smaller, and so we needed to reinflate those areas. So commonly we'll use it under the eye area, bring those high cheekbones back into play, helping with these lines in here. So it just helps to restore some of the natural aging processes and sort of revert you to where that started at.
And what are they made of?
Fillers are made of something called hyaluronic acid. Hyaluronic acid occurs in every joint in your body. So the difference is if we take some out of your joint and inject it in here, it will last 4 days. If we use the fillers that we use, they're stabilized, so they last much longer, initially anywhere from 4 to 6 months.
Is fillers dangerous to do?
Fillers are actually not dangerous to do. They're very safe. They've been used for about 30 years to help patients who have arthritis, so that's where the first usage came. They're made of something that's chemically identical to the hyaluronic acid that's in your own body, so you never have to worry about them. In the old days we used collagen, that was about 20 years ago, and I was doing those injections, and those came from a cow, so they were foreign to our body. We had to do allergy tests to determine them if you could do the treatment. Now we can just come into the office, do a treatment, and not have to worry about that because they're chemically identical to what your body makes.
Can you explain how fillers work and how long it lasts?
Fillers work because of the collagen collapse that happens in our bodies as part of a natural aging process. That collapse and descent that occurs in the facial areas, and it sort of gives us that sad, flat kind of look. So what we're going to do with fillers is basically just restore your volume and plump up those areas, and that's how fillers will work. They typically will last anywhere from 4 to 6 months.
I have heard that artificial fillers last longer than the ones that you were talking about.
I think what you're referring to are the permanent fillers. So they are what they call semi-permanent fillers. We don't use them simply because the associated risks with them is they can cause scarring and lumps and bumps that are there on a permanent basis. So because of the safety aspect of those, we never use them. We want to always ensure that our treatments for our patients are obviously the most medically sound and most medically safe procedures, and that's why we use the fillers that we use, which will last in the initial stages up to about 6 months, but eventually can last up to about a year.